How's it going, guys? So we got a patient over here. This gentleman over here works at the car wash, and for the past 8 months, he would experience neck pain, low back pain, as you can imagine from stooping over working on those cars. He also has pain at night, but he also talks about the pain and discomfort right over this region over here, and also numbness in all the fingers. So when I hear about a case like that where all the fingers are numb and the wrist pains, what have you, I want to take a closer look, see what's going on in this region over here, because we want to eliminate the possibility of what we call double cross syndrome. Meaning, if there is an obstruction going on somewhere in the neck, it can interrupt the nerve function all the way down to either to the elbow, the wrist, fingers, so on and so forth, and amplifying the problem a lot more than it's supposed to be. Okay, this feels chronic. We also got another chronic nerve right there as well. Yeah, I've got a small little reading over to the left. Right, that's right. How's that?
Yeah.
Pain right there, huh? And we check and assess every single level because I want to see where the potential biomechanical issues are. And this one is not moving right. Pain right here?
A little bit.
A little bit pain. How's that one right there? See, this one's not moving right. So we found a couple of areas that are abnormal. The 5th lumbar, 6th dorsal, and the 3rd cervical. Right now, the more immediate thing is you're talking about numbness in the fingertips and also pain in these wrists and fingers as well. So in order for that to cause all that, I'm going to take a closer look at what's going on up here. And you can see over here, your neck and your skull, the way you are right now, you're tilted significantly like this. You're lopsided. That 3rd cervical, what you're doing right now is it's rotated like this way and lopsided like this significantly. So we need to correct that 3rd cervical right over there. And that also alleviate all the nerve dysfunction going down your shoulders into the elbows, wrists, and fingers.
Okay.
I'm going to retest, see what's going to happen to these two over here. I would not be surprised if it becomes less abnormal. All right, let's roll. So we palpate and find the exact structure of what we want to correct, the 3rd cervical, in this position over here, because sometimes the structures may shift around when they're in the prone position. So now I got my finger right on the 3rd cervical. We're going to lower them down. In addition to, when I see something that's very posterior and very severe, as indicated during the examination when we test the structure and the x-ray, the high-level table is the most ideal way to correct this. Drop the belly, just relax. We want the patient in a neutral position. That's where we tuck this piece down a bit. Sink in. Just relax right there. There we go. So, what difference are you noticing with your fingers?
But not now. The pain's gone.
Pain's gone, huh? Which one's gone?
Over here with my bones.
That's right. You mentioned that you had a lot of trouble closing.
Yeah, because sometimes when I close,
Mm-hmm.
I feel like a numbness.
Mm-hmm.
So now the pain is gone.
No more numbness, huh? All right. Let's go ahead. Let's take a closer look. See what's going on your wrists. Almost good. Radius is good. Almost good. We check the scaphoid. Okay. Pisiform. Triquetral. Hamate, and also the 5th metacarpal. 4th metacarpal is a little jammed right at the capitate, right at the base. We also feel this one. See, this one's not moving upwards. So right now, this 3rd metacarpal right at the base and the capitate. Both are not functioning right. So now we're going to check the lunate. See, it doesn't go anterior. So it's stuck over here. Just relax. Relax a little more. We're going to set this lunate. There we go. We close the joint. Good. Feel that difference now?
Mm-hmm.
Now the capitate's moving. Third and the fourth metacarpals are moving. This one we need a little more set. This one is still a little bit stuck. Just let it go. So I'm going to set the base. There it is.
Mm-hmm.
See? Feel that now? Now that's moving.
Mm-hmm.
So let's check this one. Relax. Again, we rule out. Make sure elbow is stable.
Mm-hmm.
It is. Radius slightly fixated. Ulnar, okay. Scaphoid, good. Okay, that's good too. Lunate's slightly stuck. Slightly stuck posterior. All right. That's fine. Okay, you feel this over here? It's too loose. Right? The metacarpal should be stable, like this. See how much movement there is? But this one, there is way too much movement.
Mm-hmm.
Same thing with this fourth as well. Okay, let's move on. There's a pisiform right over here. Pain there a bit?
No.
No, not that bad anymore, huh?
No.
Good. Yeah, this is still moving too much. Okay, triquetral. The triquetral is not, it's misaligned. Alright. So we're gonna have some fun setting this fella right over here. Just let it go. There it is. Now I feel that? Doesn't move as much anymore. There we go. Okay, give it a nice squeeze. See how you like them.
Yeah, it felt different.
What's different about them?
Mm-hmm. So now only here and this.
Let's
I
take a
look
look.
at the only bit.
All right, so this is inflamed.
Mm-hmm.
Right. Okay, so I'm going to take a look at your pip. See what's wrong with the dip. Okay, the dip is not working right. So you're not able to flex it completely.
Mm-hmm.
Okay, so this is going to be an interesting way we're going to set this one. Just let it go. No, stay right there. There we go. Good. Go ahead. Give that a move.
Mm-hmm.
Get in there. All right. Okay, metacarpal phalangeal joint is fine. Pip joint is fine. Dip is still slightly out again. A little more. Get a little more traction. A little more, just relax this over here, a little more, as much as possible. There we go. That did it. Now move it around.
Mm-hmm. Yeah, I feel different.
Good. All right, what's next? You mentioned something wrong with the pinky finger?
No, it's good. That's good.
All right,
Yeah.
we're all set, champ.